Perhaps you're switching jobs, maybe moving on to another part of the country. Maybe you are getting married and going on a spouse's plan. There's many different reasons why you might be looking for a new health plan. And here's a guide for you. In this lesson, I wanted to talk about some of the things you might want to consider when looking for a new plan out of my book, Retirement Healthcare Secrets. It's available on Amazon if that is something you're looking for. It has guides on how you can choose the right plan. It's also helpful for someone who might be turning 65 and approaching Medicare. But obviously, we all want to be healthy, but sometimes it can be hard to pay for medical care. That's where health insurance comes in. It's a way for you to pay your medical expenses if you get sick or injured. With so many different kinds of plans out there, it can be hard to know which ones you want to choose. So here are some tips for you to look at when you are trying to find the right health plan for you. Number one, learn about your options for different plans. Maybe you're working for an employer and they're offering two different choices. Make sure to look at them both before you make your decision. Maybe you're shopping for policy in the individual market through healthcare.gov. Same situation. There are going to be different options out there. And when you're evaluating those options, you want to consider things like your budget, your family size, your lifestyle. For example, do you have young children who do sports? Maybe a high deductible plan could be a bad thing in case one of them gets injured and you get stuck with an unexpected bill. You might want to pay a little bit more. There's all kinds of variables that you should consider, and it all depends on your situation. I can't, unfortunately, sit here and shoot a video for all of you and say this is going to be the answer for all of us, because health insurance affects us all differently based upon our own unique situation. But you want to make sure to look at your network when you are evaluating a plan, and understand the fact that a lot of your healthcare costs are going to come from your routine visits. Maybe if you're going to a specialist, things like that. So make sure to look at the co-pays and the co-insurance as well. Like I mentioned before, number two, health insurance isn't a one-size-fits-all situation. So again, factor in your lifestyle. You want to make sure that the plan covers prescription drugs. Dental insurance is usually kind of a separate deal, but sometimes there are places that you can get that through the same company. You want to consider all of your different benefits when you are choosing the plan. Next, you want to compare the costs of different insurance plans and find the one that fits your budget. Because healthcare costs can vary widely by state and region, it's important to compare prices before you decide. As someone who's moved, I think I've moved to 3 different states now and have had to go through that exercise, which wasn't fun, but fortunately it helps me kind of help people through all of this. Understanding what the procedure is going to cost for the network and paying close attention to those things are really, really important. Next, you want to get a feel for what to expect when you need the medical care. So this is where you really need to do your homework in advance, because these insurance companies are really good at designing their policies and just tweaking it here and there to make it look more attractive to us, the consumer. But sometimes you can be caught with a surprise you might not have been expecting. So, for example, if you're going to have a surgery, make sure you have an understanding of what that might look like. If you have chronic conditions like diabetes, heart disease, other things like that might require more attention, make sure you're considering all of those things, because they might impact your decision. For example, maybe you want to, if you are going to utilize, you might want to pay a little bit more premiums to have lower out-of-pocket costs when you actually do utilize the healthcare system. Next up, you want to understand how doctor's visits works, because that's again going to be one of the probably the most common things you might do when you use your plan. They're very common. Most plans require patients to pay at least a portion of the doctor bill out of pocket, and that's usually what's called a copay, or co-insurance sometimes. But then also, if you're in a high deductible health plan, with most of the time your preventive visits are going to be covered. But if you have to see a specialist, you might be stuck paying the full price of that specialist visit, which could be like $300. Whereas if that's something that you don't want to do, maybe you can find a plan that has a co-payment of like $50 for that same specialist to save yourself the $250 out of pocket at that instance. But again, these insurance companies are really good at figuring it out. That's why you really need to do a comprehensive analysis of your plan design to really understand how it might be affected. Another thing that might affect your plan and the plan design itself is how your prescription drugs are covered, how hospital stays and other surgeries might affect your bill. Most people don't have enough money saved up in case they need a surgery or if they need to take prescription drugs while in the hospital. So the good news is that most insurance plans cover these costs. But it's also important for you to consider setting aside some money for an emergency expense like this, and make sure that you try and do this even before you choose a plan, because then you can have that in the back of your head. So in conclusion, there's a lot of different variables you want to consider when choosing your health plan. If you ever have any questions, you can always feel free to message me your questions on any of these issues, and make sure to check with somebody that you trust that's an expert in these areas if you need help, instead of trying to figure it out yourself. I've spent tens of thousands of hours researching the healthcare system, gone through so much of my own personal healthcare situation, and I still need expertise and help. So know that you're not alone if you're not understanding what's going on. If you'd like more information, please check out edbellis.org. It's important for you to take your health insurance coverage seriously. Whenever you need medical care, make sure you have a health plan that can handle it, so you're not on the hook for a large amount of money. But before picking your insurance provider, learn as much as you can about what they have to offer. And you want to make sure you do that so you can find the plan that meets your needs. Thanks so much for watching. Make sure to subscribe and give us a thumbs up if you like this. And check out our podcast, America's Healthcare Challenge. It's available wherever you get your podcasts. We just did an episode on the Inflation Reduction Act and how it changed the healthcare industry. And we'll very shortly be reporting on my top 5 stories thus far of 2023 in the healthcare industry. Thanks. See you next time.